Yo, what's up, everyone? In this episode, we talk with Liz Salmi. Liz Salmi has adapted to life with a brain cancer diagnosis, and she tells us how she built a good life, a very accomplished life, despite the struggles. So tune in.
Through that tragedy taught me life is finite. You really have a short window to take what it is from life that you want and enjoy it.
You can go back to that day, February 18th, 1990, and change what happened. My honest answer is I wouldn't change it.
You're just going to have to go through it, and your strength is going to be found in simply going through it and being authentic and real in the process.
I was talking with my palliative care doctor today, and she turned around to me and she looked at me and she was like, do you think that you'll eventually beat this? And I was sort of like, yeah, that's probably what I'm trying to do.
No, nothing will ever take away the pain of my daughter not being here. My reality.
Well, I know what my body's going to do to me. I've got a wheelchair in my future, but you know what I've been looking for?
What's that?
One with off-road wheels.
Just remembering me as I am, happy and energetic and full of life, no matter what.
You can expect life to kick you in the teeth, but you always get back up, no matter what, and you just keep going.
Living Adaptive with Scott Davidson, a podcast about learning to live adaptively.
Hey, what's up, everyone? We have a really great episode today, so I'm glad you're tuning in. I am with Liz Salmi of thelizarmy.com, and she's also involved with many significant organizations as a researcher and advocate, which she will talk about in this interview. We really appreciate Liz's time because she is extremely busy working on some significant things. So what's up, Liz? Thanks for coming on today.
Thanks for having me.
Yeah, so let's jump right into this, Liz. At some point, all of us will likely go through illness of some sort, physical, mental, whatever it may be. And currently, you're adapting to life right now with a brain cancer diagnosis. Can you tell us a little bit more about what's going on with you?
Absolutely. So as of the time of this recording, 10 years ago in July 2008, I was diagnosed with an astrocytoma, which is a slow-growing but malignant brain tumor or a brain cancer. And after that diagnosis, my background was in design and communication, so I knew nothing about the healthcare space or medical diagnoses. So I was immediately pushed into the world of healthcare and understanding how to pay for things and, losing my job and income because I couldn't hold down a job because of the brain tumor. I had 2 brain surgeries and then was put on chemotherapy for 24 months. And then as a result of the surgery, I had to relearn how to walk and balance and struggled with seizures, which I still continue to struggle with till today. So that's kind of the quick 30-second version of being diagnosed with brain cancer.
Okay, that's great background information. A question I want to ask that I already know the answer to, but helps the audience understand you, is you receive a lot of offers for speaking engagements, interviews, TEDx, stuff like that. Why do you think you're often chosen to come speak at various events? Because lots of people are diagnosed with illnesses or cancer or whatever it may be, but why are you chosen?
It's not something I set out to do. It still boggles my mind and it's always like, what? You're asking me to speak at a thing? It's still weird and bewildering to me. I think what was different, say back in 2008, which Facebook was just getting launched at that time. And I think at that time you had to be somebody with a special university email address in order to be on Facebook. Twitter was just getting started. So social media wasn't really that big. But one thing I started doing immediately after diagnosis was blogging about my experience. And today it's not unheard of for people diagnosed with a thing to start blogging or setting up some sort of platform to share what's going on with them medically. But in 2008, that was still kind of new. And I was a consistent documenter of my experience. This is happening today. This is what's going on. This is how I'm feeling. So I was very out about my experience. And then, of course, as the social media platforms got up and running, I set up accounts to kind of mirror what I was saying in long form into short form on Facebook and Twitter and, say now with Instagram. And due to that, of being out in that space, I was offered one opportunity. I remember the first opportunity I was invited to speak at the Health Information Management Systems Society, or HIMSS is the acronym, HIMSS, a local conference here in Northern California where I live, where they were interested in the patient's use of digital media and talking about their healthcare experience. And I had been doing that. And so someone out of the blue on the internet said, will you speak at this thing? You have 15 minutes. And I thought, wow, I'm really nervous about that opportunity, but why not? And if you say yes to one thing, it spirals over the years into other opportunities. Somebody sees you at a thing, and then the next thing happens, and the next thing. And in the case of TEDx, which is like a offshoot of the main TED conference, there are locally organized events where someone has to be authorized by TED itself to put on these local events. So TEDx Sacramento, where I live, one of the organizers there knew me just from the community, and also thought, my response to diagnosis and of a serious illness to start blogging and talking about my story was interesting to them. They thought that was a neat way to respond, maybe a resiliency aspect or way of responding. And so I was invited to speak at TEDx Sacramento. Again, I was really nervous. I, wasn't quite sure how to say what I wanted to say or what the story was. But when you do something like a TEDx, people assume you must know what you're talking about. And so I told the story, I told my story, and then from there, again, it turns into the next thing and the next thing. So, it's not something I ever set out to do. It just, things start happening when you say yes to things.
Holy shit, I forgot about Facebook needing an EDU address. But speaking of EDU address, that means an education email. You're a patient. And you had an intimidating EDU email address when we were communicating back and forth. I'm not going to say it because I'm not going to out you that way unless you feel like it. But how did you, and it's very intimidating people. It's like Ivy League intimidating. But how did a patient end up working for an academic institution?
Yeah. Great. Thank you for that question. So my educational background, I have an associate's degree in graphic design. Mm-hmm. It's from a community college here in my city, in Sacramento. And my email address is affiliated with an academic medical center. That's the email address ends in harvard.edu, which sounds really impressive. And I think it's funny because I don't even have a bachelor's degree, and yet I have this fancy email address. A couple of years ago, again, saying yes to an opportunity, I was on a panel talking about my experience and my fascination with reading my own medical records, which is a whole other story. And I ended up getting connected with a research project called Open Notes. And Open Notes is about studying the impact of when patients read their doctor's notes, which quite often, actually the majority of people don't have access to that information through our online patient portals. We really have the most basic of information from our clinical interactions. And Open Notes is like, what if you could see your full-on doctor's notes, not just that little minimal after-visit summary? Mm-hmm. And as a person who was reading, doing medical records requests and kind of investigating more almost from that citizen science level, N of one level of science, I was really curious about what I was seeing. And I was wondering, why don't most people have easy access to this information? Through that storytelling, from that experience, I was connected with the researchers at Beth Israel Deaconess Medical Center, which is a Harvard Medical School teaching hospital, where they were studying this for years. And due to my professional background in communications, and at the time when I met them, I was a director of communications for this nonprofit in the healthcare space. They said, wow, you have a really interesting way of talking about these things that our researcher staff really isn't doesn't come at this stuff from that perspective. And so they said, would you like to join our team from our communications team? And I said, yes. And in the year and a half I've been working on the Open Notes project, I've transferred from the communication side of the team to the research dissemination side of the team. And what research dissemination is essentially talking about the research to health systems, clinicians, and other stakeholders who might implement the outcomes of the research of the Open Notes team. So that's how I ended up getting that email address, because I work with them. Nice.
You work in a lot of projects. You work in a lot of open sourcing where you talk about exchanging notes that doctors have about you, the patient, and trying to bridge that communication gap that often occurs. And really that provides a lot of understanding in terms of diagnosis or outcomes too, potential outcomes. What recently you're posting about one of the projects you're working on, which is really intriguing. You're working on a project of a series of videos outlining what it's like to die from brain cancer. That's heavy. It is. It's intense. And I'm giggling because I'm like,
how that sounds so wild. I'm like going, wow, like how did that come about?
Dude, that is so wild. That is so these videos
come from, essentially?
Well, yeah, where did it come from? And it seems like you at least have the interviews down and you're piecing together the videos, which is a lengthy process. That means during this lengthy process, you get to rehear everything over and over. And how did this impact you? Where did it come from and how's it impacted you?
Sure. So I've now been living with my diagnosis for 10 years, which is a long time. And I'm very fortunate because there's many people I've met with brain tumors and brain cancers in the last 10 years as a patient who is advocating this space and a longtime volunteer with National Brain Tumor Society. So I know many people with brain cancers. And in that time, I have lost a lot of friends. People who are diagnosed with something more aggressive than myself, and they die within 1 to 2 years after their diagnosis, or people with the same diagnosis as myself, where in time, the average survival time is 7 years after diagnosis. For me, I'm 10 years out, so I feel like I'm living on borrowed time, and so I've lost friends who have the same diagnosis as me. And I am also friends with people in other cancer communities, people living with lung cancer or breast cancer. And I follow their lives and have noticed when people are nearing the end of their lives, there are different transitions they go through. And I wonder, as a person living with a brain cancer, is dying from a brain cancer different than what it's like to die from a breast cancer or maybe any other health condition where folks are nearing the end of their life. And I have really good friends with brain cancers and brain tumors. And in, the back channel of, say, Twitter, or just when we talk to each other, or we're DMing each other, or on text message exchanges, many of us are starting to wonder, what is that end of life experience like? We're seeing our friends going through it. And how come our doctors won't talk to us about it? Some of us are brave enough to ask, and then some doctors will respond, well, you don't need to worry about that right now because you're doing so well. And that might be true, but it doesn't mean we don't want to have a conversation about it. And so one of my good brain cancer friends, Charlie Blotner, who we've known each other for 4 or 5 years now, we're both doing well, but we both are living with a brain cancer. And he and I were chatting when we met up in real life IRL one day about that. And we happen to know through Twitter an amazing palliative care physician. His name's Dr. Michael Fratkin, and his practice is called Resolution Care. And he helps a lot of people who are going through serious illness or going through the end of life. And so we decided to send a video to Dr. Fratkin asking, hey, you help people all the time who are dying. And we know you've helped people with brain cancers. Can you just give us the straight up truth of what it is like to die from this disease, or what you know? Will you give us what we call the talk? And many people, the talk with quotes around it means how are babies made, and which is something you learn about in adolescence. And we were wondering, we feel like we're kind of in our adolescence potentially of living with this disease that we may likely die from at some point, whether that's years, a couple months from now, years from now, or many years from now. But we still want to know. And we felt like we deserved to know. And so we made a video of less than a minute and sent it to him directly. We actually texted it to him, and he responded like, you guys are wild, but yes, I would be honored to tell you that truth if you're ready for it. And we said yes. And so we ended up setting up like a video chat along with our other brain cancer friend, Adam Hayden. So we got Charlie, we got Liz, we got Adam, the 3 people with brain cancer. And then we've got Dr. Michael Fratkin, who and we recorded this video because we thought we'd like to refer back to it. And then later, after we recorded this conversation, which was about an hour long, we thought, I wonder if other people would benefit from hearing what we heard. And, there's questions I have as Liz, Charlie has a different perspective, Adam has a different perspective. We all have different diagnoses in the brain cancer spectrum, but our questions vary. And so we felt like many folks could identify with us, other patients with brain cancer. And so we thought it would be, I'm so weird, but I'm a curious person. So we thought it would be fun or interesting or helpful or educational to maybe break that hour-long conversation up into small, bite-sized, digestible chunks of 1 minute, maybe to 2 minute sections where there might be a main question, and then we hear Dr. Fratkin respond, and then, you hear some of our interjections and chatter, and then make it freely available on YouTube for folks who are wondering the same things and are feeling too bashful or maybe not, quote, brave enough to ask their own doctors, and maybe they can learn from us. So that's what we did and are working on right now. Yeah,
that'll be super beneficial, not just to the patient, but also to the healthcare provider, especially nurses, those in that realm. I think it will be beneficial. Good on you. This is like an excellent subject, an excellent topic. You said something that's really heavy in there, though. Like you said, a lot of things heavy in there, and you're very wild when it comes to approaching this. And your approach is definitely kind of like, let's just go get it. Let's rip off the Band-Aid. Let's just go in and just talk about it. Now, you talked about borrowed time. You feel like you're on borrowed time. Maybe that's true. Maybe it's not. Maybe you're, who knows? But how does that impact your day-to-day life with that perspective?
Oh, wow. At the beginning, after diagnosis, and especially the first 2 years and during treatment, 2.5 years of being on treatment, I really felt like I was on borrowed time. There's a lot of, I don't know. And then when you finish treatment, but you're still living with brain cancer, and there's no cure for this, you just live with this malignant stuff in your brain until it decides to grow again. I felt anxious because when you're receiving treatment and in active care, at least in my case, I felt like I was doing something. I was taking something. Something was intervening on my behalf. And when I finished treatment, knowing that I will never be, quote, cured, I then felt like I was not doing anything. And there was no actions for me to take other than sit and wait and continue to have scans and wait for this tumor to grow again. And that was really scary. And about a year of just kind of sitting there with scariness and that anxiety of, now what? More scans. I felt like, is there something I could do that would make me feel helpful? And many patients who then go on to become an advocate or volunteering with organizations find a lot of value and meaning in volunteering and maybe becoming a peer navigator or serving on boards or doing fundraising or something like that. And so to respond to living on borrowed time, there was a period of time where I felt like I wanted to make the biggest impact I could during the time I have left, which is unknown. So I thought long and hard, what are the skills that I have that I could apply to doing something for the greater good of the patient community, the brain tumor community. And I actually told myself, I set a goal. In 5 years, I want to be working for a nonprofit in the cancer space. Like that was my goal at the time. And I remember thinking, because my skills are in communications and digital communications, I thought my ultimate achievement would be being the webmaster of some brain cancer or some general cancer nonprofit. Like I couldn't see beyond my original skills because I didn't realize I would learn other skills along the way in that 5-year time. And within a year or two, I got a job within a nonprofit. And then another year or two after that, I was director of communications for another healthcare nonprofit, doing more than just being the webmaster. And then in that time, became more exposed to other patients who are doing incredible things as citizen scientists or inventing their own interventions that were helping them improve their own quality of life, meeting clinicians who are working in palliative care, hospice, neuro-oncologists, starting to stumble across journal articles, learning more about the science, learning more about the importance of having access to all of your information through your medical records in order to make important and well-informed decisions. And so where I'm at now, and I'm also a funded researcher on a project that's looking into quality of life interventions for people living with glioblastoma brain cancer. So it's like what I thought when I thought I was living on borrowed time, I was operating within the worldview I knew of myself at that time. And now, many years later, I feel like I'm still pushing the envelope of, there was no way I knew I could be doing what I am today back then. And so for other folks who are living on borrowed time, it's just like, keep going, keep getting things, keep learning, because there is a space for us as people living with disease to grow beyond the level of education or level of knowledge we have at the moment of diagnosis. And at this point, I don't feel like I'm living on borrowed time. I just have energy, and I push myself to keep going further because I can't believe I've gotten as far as I have so far.
I can. You're like in the realm of Liz Salmi. You're in the realm of probably, dare I say that G word, genius area, because just based on the interactions, I'm patting you on the back a lot, I think, but I think you deserve it here just based on what I've seen and the impacts you're having as people research you. In the show notes too, I'm going to have links as they research you, as they learn more about you and what you're doing. It's pretty incredible, but it is pretty complicated, pretty highly technical in some facets, you know. But you spoke about, I think, a project that everything you talk to leads up to this. A lot of times, everything you talk to leads up to this quality of life. And for the second half of this interview, I really wanted to dive into this because I feel like this encompasses your story, and it also will have a major impact on listeners when it comes to quality of life. And so quality of life to me means like a standard of health, happiness, comfort, despite a difficult situation. Your case, your situation is brain cancer, and you're an expert in this realm. You're funded by, you know, some pretty significant organizations to develop a knowledge base on how to build a quality of life. So what are the steps needed to just start developing that quality of life despite something such as a brain cancer diagnosis?
Oh my goodness. Well, the first step, I mean, if you're a regular person going about your day and you're doing your job and you don't really interface with the healthcare system, and then suddenly you're diagnosed with something serious, whether that's a brain tumor or any other chronic condition, a clinician, a doctor or a nurse or a physician assistant or somebody should talk to you about what is meaningful to you in your life most as a regular person, and make sure that level of meaning stays intact throughout illness. And it could be, I want to be able to continue doing my job. I want to make sure I can achieve certain goals, such as making it to my grandson's first birthday party, or see my daughter graduate from high school, or attend, the wedding of my niece. There are certain things that are meaningful to people, and that the application of healthcare interventions should not interrupt that meaning in some way. And it's different for everybody. And it's different depending on how old you are. It's different depending on your perspective in life, and the way your psychosocial family dynamics are. So to talk about what matters most to you as an individual before applying intervention is important, because everybody's quality of life is different. And not all clinicians are trained in having conversations about those types of meaning to people, because before you are a patient, you are a human being. And that's still new. And from what I understand from folks who go through medical school, especially, there isn't much time spent on conversation and delving into those important matters. And in this recording and this conversation we're having right now, I've mentioned the phrase palliative care a bit, and I will go back to that phrase because I want to make sure anyone who's listening understands that palliative care isn't necessarily hospice. Palliative care is, starts at the moment of the diagnosis of a serious illness and stays with people all the way through either A, the end of their life, or B, the survivorship stage of living with that condition, or they're done or they're cured or something. And it delves in the world of pain and symptom management for that condition, but also the psychosocial supports of how are you as a human being going through this illness and how that's impacting you, and not just you, but your care partners, whether they're family members or friends. And that kind of care is for the whole family, your whole team. Quality of life is kind of complicated in the sense it's so different for everyone, but it's also simple. Like of course, you should think first about that person as a human being before as a body part that needs to be treated.
What was it that you wanted to maintain most in your life when that was going on?
Oh, God, so great. Such a great question. So as a 29-year-old diagnosed with brain cancer, especially after diagnosis, at that moment in the first year, to me, it was autonomy. As a relatively young person, I had just bought my first condo on my own. I was not married, but I was dating. And in that age, I had a job. I had a full-time job. I didn't want to lose my job because the job meant health insurance. I didn't want to lose my house. I felt like, oh, I'm a responsible adult. And now I could not walk. I could not drive a car. I could not take care of myself. And I had to rely on my boyfriend, who is now my husband. Spoiler alert, he's awesome.
Nice.
His name's Brett. I suddenly had to rely on this other person. And Brett, who was, he was 31 at the time. He had never been a caregiver before, so he needed help. But then there was suddenly, to me, all of this world of amazing people who normally were not involved in my day-to-day care, who suddenly stepped up and were like, we're going to help you. We're going to get your groceries. We're going to bring you meals. And, I eventually lost my job because I couldn't hold on to it while I was, recovering and having multiple surgeries. But to me, I was embarrassed for myself that I needed to rely on these other people who weren't my family and were maybe former coworkers or friends. And so what was meaningful to me was I wish I could just not have to impose on anyone and bother them. And I wish I could just do this myself. And so I was scared and anxious and embarrassed. And fortunately, this whole group of supporters around me kept reassuring me, this is what we want to do. We can't cure this disease. We're not going to do the operations. But what we can do is bring you a platter of enchiladas and that you will have for dinner tonight.
Nice.
And so it kind of, I remember having big crying fits of being embarrassed that I couldn't do this on my own and that I was relying on these other people, and then having to be reassured over and over again, for an entire year or so. This is that moment in your life where you need to rely on other people. And that was hard as an independent person. So quality of life would have been, I can handle this all on my own. And then learning in time, you need to, sometimes you can't do everything, and you do need to let other people take care of you overall. And then nowadays, when I think about when, say, the brain cancer, when the tumor grows again, and what will be meaningful to me, I think a lot about like advanced care planning and what I'd want should I, be ineligible for treatment, or maybe I'm nearing the end of my life. And I've had the luxury of time to really think about this and other people as they go through illness and maybe they're nearing the end. And I thought, okay, if the time comes where I'm too sick really to receive active treatment, and I say that I'm done, and that I think there's going to be a clear line of when I'm done with treatment. And I want to spend my days like chilling in a hammock in the sun, in good weather, reading books, listening to NPR with my cat on my lap. And that will be like, that is my ultimate dream of what it'll be like. That's quality of life, just relaxing, reading with a cat. That's it. That's the most basic level of what I want.
That's beautiful. You actually talk about that. In fact, I read one of your things on that same note. You like hitting the weights and you like cats. Which one's more important to you?
Hitting the weights of the cat. Definitely the cat. Definitely, because that means if a cat is sitting on your lap, that means you are keeping still and resting and kind of at peace with yourself. If I do like going to the gym and lifting weights and having fun with my friends at the gym, which is also fun, but a cat is not going to sit in my lap if I'm in the gym. So there's this different state of motion or state of being when you're running around and being active versus relaxing. And if I was really sick I would probably not be lifting weights. Like that would go away on my list of important activities at that time for sure.
Yeah, Liz, for me, I'm a cat lover. I'm guilty. And chilling with my cat is definitely what you say when it's just like relaxing with you. And like you said, it's not, if you're not relaxed, the cat's not with you. So there's like a little bit of zen in there. How do you maintain though this happy, maintaining a quality of life when you start to lose hope a little? Maybe you're not losing hope, but you just need to maintain whatever it may be. This quality of life, maintaining, keeping things in check throughout the process. Have you heard or learned anything during the time you've worked on this project about a way of maintaining?
Well, again, it's different from everyone. I've seen folks, and I'm going to just continue to talk about like the brain cancer space because those are my peeps but hopefully people with other conditions can kind of relate what they're going through to this. But I've seen friends who receive treatment and chemotherapy up until the last week of their life. And chemotherapy sucks. That's like poison. And so to me, I go, gosh, I couldn't imagine like sticking with treatment that long when you could just stop treatment and kind of live and feel a lot better until maybe you die. But I can't impose my worldview on them because some of those people have small kids and they're thinking, I want to try everything up until that moment because I need to be there for them. So they have different needs and motivations. I have chosen to not have kids, in part because I recognize, I'm living with this precarious condition. I might not be able to provide for those folks. I've already received chemotherapy that's poisoned my whole body and might make it so I couldn't even have healthy kids. Like, who knows? So I have a different set of priorities, different worldviews. And then I have other friends who, I have this amazing friend who's no longer with us. His name's Ryan. He was 36 years old when he died. And I remember him calling me saying, where I received care at this major academic medical center, they have all of these clinical trials that they want to put me on. And if I don't do this trial, they're offering me this trial. And they're really pushing to me that I should do these trials. But I only have a couple months to live and I don't really want to be a lab rat. And I said, you don't have to do those things if that's what you don't want to do. This decision is all on you. And if you feel like someone's pushing treatment on you that you don't feel comfortable with, you're allowed to say no. And this decision is all up to you.
There's a lot of lessons learned from going from a situation where whether you're diagnosed with brain cancer, you have another situation that sucks. Maybe you're going through trauma, tragedy, loss, whatever it is, or depression, or it could span so many different realms. In your realm, what would you change about maybe one of your responses to the diagnosis, like how you handled it, or maybe there's a technique you would have implemented a lot earlier, or in general, what would you do differently?
Something I wish that could have happened that didn't happen that I know now is to understand more about the different roles of the actors or the characters of my care team, my clinical team. So in oncology or neurology or just serious illness is there, we have primary care doctors and then you get a specialist. So in my case, a neuro-oncologist, and then there's a neurosurgeon and there's a nurse practitioner. But then there are other people, such as social workers, chaplains, palliative care team, and physician assistants, like these other players that we're never really introduced to and clearly explained their role or maybe the full breadth of what we might get out of working with these people. But I wish I had known more about the different players of the team. And so I could have taken advantage of their expertise, such as working more with a social worker, or I thought a chaplain was a religious person, which they kind of are, but they are really work in a non-denominational capacity to help with your interpersonal struggle of maybe your changing identity now as a person living with illness. And something I regret is not having known really what the role of a hospital chaplain was when one came to see me. And I remember being, fresh out of brain surgery. It's the next day. I'm laying in my bed, really out of it. And a person came in my room and introduced themselves as the hospital chaplain. And I believe they were trying to be clear to say, hey, you know, I don't represent any particular denomination, but if there's someone else you'd rather talk to, I could refer you. But I'm here just, you know, check in on how you're feeling, you know, your being with yourself, and some really good stuff. But I remember thinking that they were there to sell me on a religion, and that freaked me out, and I was out of it. And I said, get out of my room. And no, I don't want to see you. And then the next time a nurse came into the room, I told her, hey, I don't know what that person's about, but I thought that was inappropriate. They're here in my room and invading my space. And if they were a nurse or a doctor, by the way, I wouldn't have had a problem with them, quote, invading my space. That was their job to check on me. And I didn't know that the hospital's job was to check on me. So I told the nurse to, you know, make sure that person never comes back. And so she put in my chart, patient refuses chaplain services, note to the team, don't send chaplain in. And that in my record becomes a permanent thing in my medical record. And it's carried with me, even though I never saw it till later. And so I never was offered a chance to talk to a chaplain again. And many years later, in meeting chaplains and understanding what they do, they actually provide a really important role. And I think most people we would assume this person's there to talk to you about, you know, to pray with you and maybe talk about God. But I didn't realize that there was so much more that they did, and I actually would have benefited from. And again, just that's one illustration of understanding what everyone does. And there could be a better, from medicine side, from the team care side, a better introduction. Like, hey, Liz, here's all the people that could be involved, and here's what they really do. And we're here to help you in all these different ways, and you can call on any of us. But our doctors are their time is so demanded by the different patients that I actually could have received faster follow-up if I had reached out to a different member of the team. But I had no idea that these other people could do more things than what I assumed they could do.
Sure, and that does make sense, especially communicate. Just having that and being informed going into this, that these things could pop up. Now, I wonder, you speak to audiences that face similar challenges. Obviously, you have your crew, your posse, your tribe, and then you also speak to audiences that just are learning about you, or you speak to audiences that want to learn about how to adapt to life with significant changes. What are some things or a thing that you applied in your life that helped you adapt? Maybe it was something like incorporating meditation. Maybe it was something like reading these resources. Maybe it was working with a group. Maybe it was writing. What are some things that you utilized to help you adapt to this?
So we all have different mindsets of how we all will instinctually respond to things. I think what has helped me is something that was innately just part of me. And not everyone can change who they are, but for me, I have a strong sense of resiliency, a strong part of me that was a resilient person, which I didn't realize was a thing. And I responded to this situation in different ways, you know, of course, fear or anger or sadness. But a main theme is I was curious about this condition, this disease. And it was so boggled my mind. I was like, what? Brain cancer? I didn't do anything to cause this. So I knew it wasn't my fault. And so I was just curious about how the brain worked, how that might impact me. And I immediately just wanted to learn as much as I could. Because to me, not knowing stuff is scarier than having the full story. Not everybody feels that way. Not everybody has the same response. And some people don't want to know anything about their disease and would just say, hey, give me whatever I need to take, doc. I don't want to know all the stats or whatever. So to understand what is the best method for you and to communicate that with your team, with your family and your care team. So some folks may say, I don't want to know anything because learning more will scare me, or I want to know everything. And so my doctors knew early on, give it to me straight. That's what I need. And another tip would be, and I found this helpful to me was just journaling what was going on from a day-to-day perspective, how I was feeling. A lot of times if you're diagnosed with something serious, your friends and family want to know what's going on with you. You might get a whole bunch of phone calls or text messages or emails, and it's hard to respond to everyone. And so my way of navigating that almost as my own communications director of my life was to start blogging about this experience to translate what I was going through to this audience and my family and my friends, so they knew where to go for the latest update. And then I wouldn't have to deal with following up with everyone individually, because managing all of those follow-ups becomes a job. And you don't have to start a blog, but it is very helpful as a strategy of communicating with friends and family.
All right. I was going to say I was going to follow up with a heavy question, but first a lighter question. Once you start becoming like more public, you're out there on a blog, you're doing whatever it may be, speaking or so forth. Oftentimes we get comments, and some of these comments or people approach and say some crazy stuff. What's one of the weirdest things that has happened to you since you became more public? I'm just curious.
I think comments, of course, you're going to get people who don't know anything about your disease wanting to tell you about something they learned from Dr. Oz and say, yeah. Oh, you could cure your cancer with CBD oil, or you don't need to take, these drugs, or you don't need to have surgery. You could just, do this other alternative therapy and don't buy into what pharma is selling you. So you're going to get regular folks kind of giving you your opinion, and it's hard because at first you get angry and then you just have to learn to ignore it. But I'd say the weirdest thing I had someone say, and I feel bad because this is my sister, and I've shared this before, and she thinks I'm ganging up on her, but I'm not. Is I remember the way your diagnosis impacts other people is real, and they go through their own emotion of what they're feeling, and then they feel guilty kind of imposing that on you. So you don't know how other people are hurting because they're afraid to tell you how they're hurting because you're hurting. And I remember my sister breaking down with me on the phone and crying about what she was going through. And she said, first you get diagnosed with cancer, and now my dog is diagnosed with cancer, and I just can't handle it anymore. Yeah. And so she didn't mean to, but she was kind of equating, this thing with her dog also. And I was pissed at the time because I was like, that's, our dogs and our pets are very important to us, but I'm a human being. I'm your sister, and I can't believe you equated me to your dog. So we got in a little bit of a fight over it, but I'm over it now. And I would say that it was the weirdest thing someone said to me during that time, for sure.
You talk about people you've worked with that have passed on. You've talked about people that I'm sure that have dealt with their loved ones passing on, like the doctor from Colorado. And it doesn't necessarily have to be, in fact, it shouldn't be just cancer patients, because you're talking to everyone. People are hearing you in a very broad audience. It's not limited just to your tribe. When you talk to them, when somebody's really down, when they're like, I'm about to give in on this thing's really beating me up. In the case, it's for your tribe that may be dealing with brain cancer, and they're just like, this is overwhelming. How do you get them to, or not get them, but how do you help them? What do you say to them to, get through that next day?
It's hard because I don't have the answer to everything, but it's interesting that you asked this question because I just talked to somebody yesterday who was going through this. A friend of mine, his girlfriend, who I didn't even know, he asked, can you speak to my girlfriend? She's dealing with this serious, this really rare diagnosis of this chronic pain syndrome of the nerves. It's very rare. It's hard for her to get access to treatment. It requires her to be on some opioids. And as we know, in the opioid epidemic, they're cracking down on people being able to access the medication, certain medications. And so she's actually a legitimate person who needs those medications, but her insurance, she's dealing with all kinds of craziness. The insurance, just experiencing the pain, trying to get through day to day, can't use one of her hands anymore. Her dominant hand, it's wild. And so I met her yesterday for the first time, and I didn't know what to do. My friend said, hey, you know things, you're in this space, well, you just talk to her. And I'm not an expert. I'm not a clinician. I'm not a academic. And so I just sat with her and listened and asked questions, and she was really dealing with that loss of identity of who she was before as this active person running her own business until she had this wild accident and shattered a thing and now can't use a hand and can't work. And so all I could do was practice those active listening skills that I've learned from clinicians and ask her questions and dig more into how that made her feel. And the thing that I identified with most is that there's this moment in time where you get diagnosed with this thing or something happens, and now the rest of your life is different. And for me, I can look back for the last 10 years and yes, something happened that has changed the trajectory and the course of my life forever. And I can look back now and go, I remember day one, and I had no idea any of this stuff would happen over this next 10 years. And she's at day one and doesn't know what the next 10 years looks like. And so all I can say is, you don't know what next year is going to look like. Something exciting could be happening within the next year, and you're in the middle of it. Or you will learn something, or you will experience something that clearly your life has changed forever. But it doesn't mean that what you're looking at is a bad forever. It just means something new is happening. Things happen to people, good and bad things, that change our lives forever. It could be you had a baby today. Clearly your life is going to be different forever. It doesn't mean it's a bad thing. So I just try to ask questions about, going forward, what are you most excited about, or who can you rely on, or what are you learning right now that you think might help you moving forward? And so, again, I don't have the answers. All I can do is maybe there's a bit of maybe in my life story, there's a bit of a model of how some interesting, maybe perhaps even fun stuff could come out of a change in a life like this.
What was your favorite book while you were going through all this? Because you're a reader.
Yeah. I would say there's so many good books. I could go on forever, but I'm going to name a book I was given in the hospital after my first brain surgery, which I think kicked off everything for me. Mm-hmm. And a woman who is a nurse, gave me a book called The Brain That Changes Itself by Norman Dioge, who's an MD, a neuroscientist. And the book, which again is 10 years old now, was written about neuroplasticity. And it was mainly around brain injury, which a brain surgery is kind of a brain injury, about how the brain has the ability to rewire itself to relearn how to do things. And I read the first chapter of this book 2 days after brain surgery and was like, no way. What? The brain could do that? Unlike any other part of our body. Like how a starfish can regrow a new arm or leg or whatever starfish has, an appendage. And our brain can do those things. It takes time. You got to heal, but you can relearn to do stuff, or the brain can relearn some things, even though there's damage there. And I was so excited about this idea that the neurohospitalist who was assigned to me in the neuro ICU came in and he saw me reading this book and he was like, what are you reading? That's awesome. And I was like, I know, I can't believe this is so cool. And he talked with me about the brain and clearly this new curiosity I have 2 days after brain surgery. And then he emailed me a number of books to read, which kept me going. And so there's no one book, but to find like what lights you up, what gets you excited, what thrills you about this new journey you're about to embark on, anything that can do that, suck it, absorb it, suck it all up. And like, there is an opportunity to get excited about what is now ailing you, because every little piece of information you have is going to help you as you're part of this new journey. This is now part of your life, and it doesn't have to be horribly bad. You could be part of owning it.
Nice. Now, what has this taught you about life? You're young. Excuse my language, but you're young. You're young, and you got a stack of stuff that you had to deal with. What has this taught you all about life in general?
I hope one day to be really old and to be able to say wise things looking back. But I think, there's a woman I know, her name's Shirley Otis Green, and she's a LCSW, so a social worker who works with people with cancer. She was at City of Hope for over 20 years. She's amazing. She publishes stuff. And I talk with her on the regular because she's kind of a mentor and inspiration to me. And I check in with her every couple of weeks about what I'm up to. And one thing she says to me as an outsider looking in and commenting on what I've been up to over the last few years, is she's like, every time I talk to you, there's so much progress from the last few weeks of where I'm getting involved or learning new things. And so there's this, when she's able to reflect to me over time, and when you're living with stuff or your life, you don't see the trends, you just see from day to day. So having an outsider who's been part of my life who can reflect and help me recap my life every couple of weeks, I'm able to see that I'm growing a lot. And so when you have someone else who can point that out for you, that isn't your partner in life, somebody lives with you, sees you day to day, it's able to point out to me that there's this, you specifically asked me about like, what have I learned I could share with other folks, that we're constantly growing. We have this ability to grow. And just because we think we have the certain parameters around our life and that we're stuck with a certain lot in life, we don't. We all have the ability to actually break outside of what we thought we were, to do things that excite us and are interested in us. And you just, okay, now I'm sidebarring, but I was with a Lyft driver the other day. She was driving me home from the airport.
Yeah.
She's 24 years old. She's taking a break from school, and she felt like, oh, I don't know what I want to do, and I need to go to college, and I don't know what I want to be. And I was getting this degree in this thing that I'm not interested in. And I said to her, I'm like, you know what? Whatever you get a degree in right now doesn't matter. Because odds are 10 years from now, that industry will, 5 years from now, that industry will have been disrupted. And it won't exist in the way it exists right now. So what you're gaining in this degree is just the skills to work with people or maybe communicate with others. It really doesn't matter, because whatever you end up in might be totally different, because the way the world is working, things are just changing every year, 2 years, 5 years. And so it's just getting those skills, those basic skills. It's like getting your own knife set, getting your knife skills, and then you're going to go off and become a chef and cook some amazing meal or craft something different. So it does, whatever you think you are or developing right now is not predicting the rest of your life. And so there's so much opportunity to just take what you're learning right now and be creative and apply that to, it could be your health, it could be your diagnosis, it could be helping other people, or applying what you've learned as the manager of your care to the work you do in some other space.
I want to note that when you approach this quality of life on the technical side of it, when it comes to medicine, brain cancer treatment, it's super technical, but then you have this very big abstract side to you too, where you're looking at this whole picture of not just like, let's communicate with doctors and stuff. It seems like you have this big abstract side to you too, where you're talking about, things change. And while things change, you can always grow in that process. How do you, for you, cultivating that growth seems to be learning. Would that be correct?
Yeah, I'm sucking in information all the time. Just absorbing. Just
like a vacuum for information. It does seem like that. It seems like you're always every realm. If you go to your website, you have like so much stuff you're covering, so much stuff that you're in. It's pretty incredible. It's pretty incredible. Most people I interview will be in one realm, or they'll stick in something like maybe an adaptive athlete will explain how they made it through, an injury, an accident, and then ended up where they are now. But you have this approach where it's like there's not enough time to get everything done. Each day doesn't provide enough time to hit all the things that you hit on. It's pretty amazing. And that seems to be one of the things that pushes you. I'm guessing. I'm just saying from an outside point of view, it seems like you're really driven. You're so driven.
Thanks for noticing that. I definitely think just over even like the last 3 years, it's been a lot of that. And you mentioned my website, my blog. I actually almost can't write anymore, because I feel like anything I say at this moment is I will have learned more, and I can't get my thoughts out fast enough. So I've been thinking about how I might redesign that website and say, here's the last 10 years. That's what was going on when I was 29 years old. And then 30 years old, and 31. And when I look at things, I looked at something I wrote in 2014 when I was 34, 35. I'm like, oh my gosh, I now have a new way of looking at that. how do I edit that, or do I edit it? Or it's more like a time capsule of what's been happening. A time capsule, that actually might be the best way to describe it. And so especially getting a chance to work with my colleagues on the Open Notes Research Project, and then working with Bethany on the Brain Cancer Quality of Life Collaborative, and these two parallel projects and worlds I've been working in, where I'm working with two different groups of folks, but what I'm learning from those two different groups totally interact with each other, where if I learn something in one area, it applies to the other area, and I'm able to bring what I learned to this other group, and they didn't get a chance to learn about, like, I'm able to bring a new insight that they might not know because I'm working kind of on these two different projects. And I definitely think I'm in a period of extreme growth right now, which is really exciting, but also I almost can't talk about it because it's so exciting. So I'm constantly kind of trying to arrange my thoughts. And I will say, just if you or others might be thinking about, well, what might I be learning? I'm consuming a lot of podcasts right now that are
nice.
Medical podcasts. And I'm learning about how doctors talk or think about patient care, which is fascinating. And there's a really good one called The Curbsiders. It's an internal medicine podcast. And that's a fun one. And I've been listening to one about medical informatics, which is fun. Again, I put quotes around it. I think it's fun. Not everyone might think it's fun, but there's a lot of places where you don't have to have a medical degree or access to get behind a paywall to read a journal. That are free and open to anyone if you do want to learn new things.
Yeah, I'm a big fan of, I used to listen a lot more. There was one that was really good. I don't know what happened to it, but it was a regenerative medicine podcast out of the University of Pittsburgh. And that's where I went to school. So of course I just looked, I'm like, any Pitt podcast out there just for the heck of it, like years ago. And it was so good. Just hearing how they're researching. It got a little complex for me, but I got the idea, the overall idea of it. But you're right. Some of those are so interesting. You're going to be speaking, you're going to be out, you're going to be doing a bunch of stuff. What is the best way for people, for those listening, to get to you? Is it social media? Is it email? If they want to reach out to you, talk to you, see your videos, do stuff like that.
I'm a big Twitter person. So Twitter is awesome. My handle is the Liz Army. So at the Liz Army on Twitter, I think is the best way for folks to reach out.
All right. So I really appreciate you coming on. Thank you so much.
Thanks for having me. I appreciate it.
And that's our episode. Remember, you can find contact information for guests in the show notes or on our website, livingadaptive.com. On livingadaptive.com, you can also find previous episodes, writings, and a bunch of other good stuff talking about adapting. So go there. Peace.